So, good morning everyone, and welcome to today's meeting of the Health and Wellbeing Board. This meeting is being webcast live and will be available to watch subsequently on the Council's website. Members of the public and the press may record, film, photograph or broadcast this meeting when the public and the press are not lawfully excluded, providing due courtesy and respect are shown to others in attendance, in line with the Council's published guidance. I'd like to remind you all to turn off or change to silent any electronic devices. And you'll be happy to hear we are not expecting a fire drill this morning. In event of the alarm sounding, please leave the chamber by following the fire exit signs at the rear of the chamber. Fire evacuation instructions can also be found on page 4 of your agenda. But welcome to you one and all. It's good to see happy smiling faces. The sun's out and we're all here looking forward to another Health and Wellbeing Board. I'd like to say welcome this morning to not only the people and board members here in the chamber, but those watching online, a member of the public who we'll shortly be speaking to, and also our observers, which include Beccy Hopfensperger, who's the Chief Resilience Officer, and will here for the first time and with a radiant smile, and also Kath Byford from NSFT. So good morning to you and thank you. If we're all ready, I will start with the first item on our agenda, which is the appointment of a representative from the Suffolk Care Association. We've been asked to approve the appointment to the board of Joanne McCall, Suffolk Care Association. I would be happy if we can do that by general affirmation, unless there are any comments. There is everyone is looking at me and smiling, so I take it that is then affirmed. Thank you and welcome to the board. Agenda item 2 brings us to public questions. Now, this is a first for me. In 2 years, it's the first public question I've had. So welcome. Come forward and let's hear your question. Thank you.
Is it on?
You are, yes.
Yeah? Okay. Hold on. How will the ICB link health literacy with this proposal in item 8 in meeting its stated outcomes for health inequality in regards to the prevention of sickness via informed consent for medication prescription, vaccination, especially in a community setting, understanding proposed care and understanding the possible side effects that may come from not having the ability to read package inserts or understand the possible consequences of taking or not taking a medication, especially in regards to those who cannot read or write. Thank you.
Thank you, Mr. Catchbourne. Thank you for being very concise with your question. I would ask Ed Garratt to respond, please.
Thank you very much for the question, Mr. Catchpole. So it's very much our ambition that we embed health literacy into our commissioning going forward, whether it's contracts or our strategies and so on and so forth. We're investing in a team that will be working on this specifically. So if it would be helpful to you, I'd be very delighted to introduce you to some of the colleagues that will be looking to improve our work on health literacy. And I'm guessing that you have a passion and an interest in this, and maybe you'd like to help us make sure we get it right. So if that would be helpful, I'm very, very keen to liaise with you after the meeting and ensure we take forward your concern.
Thank you, Ed. And Mr. Catchpole, it's quite a coincidence. We had a meeting of our local hospital, the annual general meeting, just last week, and I asked the representative there exactly the same question. And so it is very, very important, and thank you, Ed, for the response. Would you care for a secondary question. Please, just a question and not a statement. Thank you.
Is it on again? Thank you, Ed and Steve. Regards to health literacy, obviously it can work in both ways. So those people, my passion, I'm not going to make a statement, but my passion, as you made reference to, is I was a healthcare worker for 12 years with people with autism, Alzheimer's, dementia, and my question is, the people who are communicating the information about health literacy are often the people who benefit most from the information given by the MHRA. So those frontline healthcare workers may be at times conflicted with some of the advice that they are giving to the public. For instance, their vaccination rate in 2018 to 2019 was at 56% for flu and is now down to 49%. And that's up to January, so there may be further movements in that. But my question is, do you feel that they may be conflicted giving information to the public when they themselves are questioning the very information they're getting from the MHRA?
So as a country, we have some very robust processes in place around keeping people safe. Around medication, I think I think it's the yellow card system in this country is the envy of quite the rest of the world. So we have a system in which people can report adverse experiences and things like that, and we have a significant resource with regards to assessing and evaluating the effectiveness and safety of medication. So as Director of Public Health, I feel confident that we have a good programme in place. I think clearly there is a challenge around people worrying about the safety of some medication and vaccinations, but I think when you go into the data and look at it, actually it's very clear that these things are very safe and actually they're important for protecting people. So from in that sense, I think we have robust processes in place, and for me, quite clearly, it's important that we have conversations with people to help them understand both the harms and benefits of things, but also make sure that people have got reliable, clear information, which unfortunately there is a lot of other information out there which is not necessarily based on clear evidence.
Thank you, Mr. Catchpole, and thank you, Stuart. Move on to agenda item 3, which is apologies for absence and substitution. Susan, could you help?
We have received apologies for absence from Henry Griffiths, who is being substituted by Kimberly Reach, Councillor John Cook, Councillor Bobby Bennett, John Dugmore and Tim Passmore.
Thank you, Susan. Agenda item 4, declarations of interest and dispensation. Do we have any declarations outside of the norm that we need to record? Doesn't seem to be the case. Thank you. We'll move on to the minutes of the previous meeting, and we are asked to approve as a correct record the minutes of the meeting held on the 13th of November 2025. Are there any comments or amendments to those minutes? There are not. I will sign the minutes as correct. Thank you. Agenda item 6 is an overview of the annual public health report launch, which in a second I'll ask Stuart Keeble to give us a verbal update, but my own comment on that, it was an amazing launch, and I must say, quite impressed and astonished at the level of articulation by the young people who made the effort to be there. They wholeheartedly gave input to make the morning very, very special. And I'll leave Stuart to let us know what the next steps are on this course in this year's report.
Thank you, Chair. And I'm biased. We helped to organise it, but it was, and I think independently, a number of you fed back about being a really empowering session, and I think it's quite clear that the reason why it was so effective was because of the young people there. And actually, there were a large number of young people there, so not just one or two, but actually in all our groups. So I'm just going to just reflect a bit on that session and think about what's next and make an ask to you as a board. So, because what I don't want this to be is just a report we did it today, we're done, because we're not done, and this is just the continuation of the journey that Suffolk is on. But for those that weren't there and maybe have not seen the report, so this year's report focuses on youth social action and deliberately young people, so particularly that kind of secondary age, end of primary age, because we often talk about the best start in life, so particularly the 0 to 5s, but actually we've got a group of young people that also, as Steve said, are very articulate and we often talk about them and about the concerns and challenges about what young people face, but we don't always talk about what's good that's happening about it and what they're possible and capable of doing. So that session we had in January very much built on that ethos of for young people, by young people, and the report outlines a number of hacks that we took place over the county, working with young people, leading those conversations with other young people about what's important to them and their communities around health and well-being. And the event that we had was facilitated by young people and again did an incredible job. I can sit there thinking that I don't think I would have been able to do what they did when I was that age, but also young people taking part and speaking, and the report is very much built on that ethos. The videos that have been done for the annual public health report were recorded by young people and edited by young people, and the coverage afterwards, particularly in ipswich.co.uk, was also done by young journalists as well. So that ethos runs all the way through it, and I think that's the ethos that I want to talk about a bit as part of this session. And I think the feedback actually from the young people was incredible, because they said, can we do this more often? Because they wanted to be in the room and they wanted to be part of those discussions and decision making around that. So I think when we look at what was said and in the report, there's some really clear steers from what young people are saying is important to them. Now there's kind of two phases to this. There's going to be some work where we've got some funding to do some further hacks in communities for young people to identify and to build on what they've said, but then also to work with them to come up with solutions and to give them some money to do that. And that's actually one of the unique things that doesn't normally happen. We often go to young people, ask them what's the matter, and then we then go away and try and then come up with a solution as the adults. But actually there will be resource to follow that. But the thing I kind of wanted to flag today is this way of working, and some of your organisations are already doing this, but actually we've got that feedback in the report, which is in a really clearly, easily understandable way. And I think one of the asks is, what can you as organisations do to take those recommendations and suggestions from young people back into your organisations to do that? And I know I've had a few conversations with a few people who've already said about how you're thinking about doing that. But I think for me, the money is one part of it, but actually if we want to embed this, then it is really looking at how we grow and build on some of the work that was done in Ipswich already across the whole of Suffolk to embed youth social action across what we do. And I think it heavily links with the My Health Our Future item later on as well, and about what young people are saying from those surveys. And very much youth social action for me is an intervention as much as a way of working. Actually, young people being involved, actually being connected to each other, having purpose, listening, and being able to develop skills is a really important part of their health and well-being. So I think we will share out the findings of the report again in case those people that might have missed it. But I think for me, as the follow-up to this, is about what you might be able to do to take that back into your organisations and to embed that into your business as usual, because that's what will sustain it in the longer term. So that was really just what I wanted to say today. But just thank you for being involved, and definitely want to keep the energy going around this.
Thank you, Stuart. I echo those words. A very, very important move forward to give the young people of not only Ipswich but the whole of Suffolk a voice in what we deliver in public health. We're only asked to note that for information, but my thanks go to everyone. Agenda item 7 is the Suffolk Better Care Fund. The report will be giving us an update, and I welcome Alyssa to the board this morning and ask her to introduce herself and present the report to us. Thank you.
Good morning, everybody. My name is Alyssa Rospeliosi and I am the Assistant Director for Strategy and Change and Access. I work across adult social care at the County Council and the SNE Integrated Care Board. And as Councillor Wiles has said, I'm just going to give you a brief introduction to the Better Care Fund report. The report, first of all, presents the Q2 and Q3 reports for the Better Care Fund. I think I'd like to highlight that it's a really positive performance story. We have all metrics on track as at Q3, and the only challenge has been some minor data issues highlighted in relation to one of our hospital discharge metrics. I would say that performance against the other metrics around hospital discharge alongside our local data has given us no cause for concern around this. We just have some further work to do to ensure our reporting is well aligned with NHS England across all 3 hospital trusts in Suffolk. And so as a result, we've just noted those challenges in the report. I would say that our sustained investment in reablement services that's enabled through the Better Care Fund, alongside our close joint working around transfer of care pathways, have both been sort of key contributions to meeting that performance this year. In terms of expenditure, we are on track to fully spend our funding allocation in 2025-26. The only changes to the plan this board signed off at the start of the year have been around the Disabled Facilities Grant. And that's because, as board members will recall, we've had a series of allocations of additional funding midway through the financial year for DFG, which resulted in a carry forward, first of all, from last year into this year's plan, and with an extra £610,000 awarded in February. This is very welcome additional money, but is unlikely to be spent in this financial year. So there's ongoing work through the Disabled Facilities Grant Working Group, which reports into the Suffolk Housing Board, to look at how that's best allocated and deployed. And that will be looking at all options to strengthen the pathways around DFG, including some of the assessment capacity that's needed to make sure people get those adaptations in a really timely way. The report has been developed, both reports have been developed jointly across health and care, have gone through assurance from a senior officer group to make sure they've met the national planning conditions, and by finance and performance colleagues to make sure the reporting is robust and accurate. So I hope that gives the board assurance that the reports are compliant with our national guidance. I'll move on then quickly to the wider Better Care Fund review and just give some highlights of the work that's been done in that space. So a substantial piece of work has been undertaken to revise the Better Care Fund portfolio for 2026-27 to give a much clearer focus, particularly around intermediate care schemes and provision in Suffolk. This approach aligns with our future strategy for Suffolk, with the future policy direction for the Better Care Fund, and critically sits really well with the agenda around neighbourhood health plans. So the work that we've done this year will set us in really good stead to follow the national direction in terms of NHS planning. It will also give the Health and Wellbeing Board a much more coherent view of what the investment and the fund is achieving and how this links to the overall performance metrics, and so we'll be incorporating that into the annual plan for sign-off in May of 2026. As many members here will be aware, we also held a workshop in January of 2026 to identify opportunities to strengthen Better Care Fund governance. The report sets out some of the key themes from the workshop, and an action plan is being developed to take these forward. This will include a briefing early in the new year to cite Health and Wellbeing Board members on the 26-27 plan, objectives and revised portfolio. Further work to strengthen the links between the Disabled Facilities Grant and other elements of the plan. Strengthening and formalising the approach for award and evaluation of Better Care Fund funding, including clearer data, evidence and assessment against performance indicators. Building in greater use of existing feedback from residents and communities into that evaluation, and working with we want to explore working with Healthwatch in its new form to commission a more bespoke piece of insight to inform future planning. Using the planning process to challenge for more innovative approaches to commissioning, again in line with some of that closer working with communities. And last but not least, continuing to increase our focus on prevention. So the action plan, once completed, will be circulated, and I'd really like to thank Health and Wellbeing Board members who were able to attend for their time and contribution to that workshop. So in summary, we're just asking the board to provide formal sign-off of the quarterly submissions and to note the progress that's been made in implementing the recommendations from the review. Thank you.
Thank you, Alyssa. As you mentioned, the workshop was well attended. It was very helpful. There were lots of input which will help us moving forward. I'd like to open this up to any questions or comments from board members, please. Gareth and then Ed.
Thank you. Thank you, Alyssa. Really welcome the report. I think there's a lot in there to celebrate around performance, I think particularly around residential care admissions as a measure of system health and how we're supporting more people in the community, the investments into primary care and things to support people. So I think it's looking really good. As well, welcoming the review of the Better Care Fund. I think nationally there's a commitment to reform of the Better Care Fund, and next year should be seen as a transitional year to new arrangements linked to neighbourhood health and care frameworks. So there's a lot of work in progress, and kind of looking forward to seeing the output of that. So thank you.
Thank you, Gareth. Ed, please.
Yeah, it's a really strong performance, thank you. I'm just interested in your perspective on what more we could do to improve the performance further. Is there any kind of areas, schemes that you think we could invest in or consider?
Thank you. Stuart. Sorry, Alyssa.
So I think these are part of the ongoing conversations that we want to take forward in partnership next year as part of that transitional year, Ed. But overall, it feels as if the alignment is really around that shift into preventative working and preventative investment. As Gareth's highlighted, I think we're already demonstrating some of those benefits really live, aren't we, in terms of the really strong performance around hospital admissions, residential care and discharge, and it will be building on some of that learning around reablement, the kind of increase in the scope of reablement and the range of partners who are involved in delivering that, and linking that into some of the work that's linked through the ICB around sort of getting ahead in terms of care management and some of those cohorts of people with those really intensive needs. So a bit of a broad brush answer, I'm afraid, but I think that's where we see the direction of travel and those partnership conversations being really strengthened going forward. Thank you.
Thank you, Alyssa. Stuart, please.
Thanks, Alyssa, and again recognise the strong performance. At the workshop we run, which was really helpful, I think, both for helping board members to kind of get their heads around the BCF, which is always seems in the past has seen a bit of a black box, but actually over time you've been doing a really good job of starting to try and help everybody understand what it means and around that. We obviously had the discussions. You mentioned prevention there, and I think for me, and I appreciate I'm like a dripping tap a bit on this one, is we've obviously got those very proximal preventative activities about both helping people to help them come out of hospital and also to prevent the very immediate bit. It was just around where the discussions are taking place, and maybe those next levels of, if you think kind of an onion, the core bit is those very, very proximal interventions around either preventing admission or helping people to leave. Those next layers out, which might be a bit more preventative in that wider sense around trying to support people to be able to stay in home, which might be around some wider social issues or other issues around that. I just wondered where those conversations are taking place, because I think it's acknowledged in the paper. It's just understanding what that might mean.
And I appreciate others may wish to come in on this point as well, but I guess for me it is around that really strong connection into neighbourhood health planning and that feeling like the strategy there feeling like the right forum to be having those conversations around that community and neighbourhood level working across the piece. There is work we're starting to scope up around looking at the future strategy for intermediate care, and again how we broaden the focus of what we consider as intermediate care beyond those sort of immediate proximal interventions into that kind of wider thinking around short-term interventions and short-term support. So I'd say that's the second strand. And I think that the BCF is a piece in the jigsaw around that that gives us the opportunity to have that really sort of focused group of schemes against those broad objectives and to monitor their impact. So it's more of a mechanism for the delivery that will really help and strengthen the implementation of those strategic conversations. Thank you.
Thank you. Are there any other questions or comments? Yes, please.
The extra funding that's been allocated, what was it, the 6? Oh, sorry. Was it me? Yeah. The funding that's been announced, it hasn't been given to the district, the extra funding that was allocated, it hasn't been given to the district and borough councils yet, has it?
It will be in the process of being passported through. I don't know exactly what the date is for pressing the button and having the money land, but
okay.
The conversations
And will that put them at a disadvantage to spend the funding because it hasn't been allocated yet?
I guess the challenge around the spending of the funding is really around the timing from central government. We're kind of in a bit of a bind with that in that it's very welcome, but it comes in only 6 to 8 weeks before the end of the financial year. But there is that acknowledgement that we can carry forward that allocation. Okay. So we won't lose out.
Okay.
Thank you both. And Joanna, hope it's working now.
Well, I think it was. It's just I don't know how to use it yet. So it was just really to say, as an association, our providers would definitely welcome more preventative measures before we end up with failed discharges, and for whatever reason that, you know, we as providers, we know that what we do in the client's home before they get to the hospital situation always improves that resilience for them. So we would definitely welcome that and be happy to be involved in any information we can give you.
Thank you. And I think that's absolutely in line with the core principles of the Better Care Fund, is sort of recognising that contribution that social care makes into health. So, of course, our care market is a really key aspect of that work. I'd be more than happy to catch up with you around what we've been doing in some of that work through the review, and what the intentions are around the evaluation and how we can work with you to support that. Thank you.
Of course.
There you go.
Thank you so much. Kath Byford from NSFT, the Mental Health Trust. I'm just thinking in terms of the development of the 26-27 Better Care Fund, whether we need to take the opportunity to bring mental health more prominently into the work of the Better Care Fund. One of the things in particular, is a simple example, but I think mission critical, is the support for our unpaid carers. So within all health, but particularly mental health, I don't think the population would manage without the unpaid carers, and it is so important that we do more and more and more to identify them and identify them what they need to support them to maintain their role as an unpaid carer. It can make such a difference, and certainly in the world of mental health that spans all ages, both from the people who are the recipients of being unpaid carers, but also the unpaid carers themselves are all ages as well. So I would really advocate for us to have a big focus and step into the world of mental health and learning disabilities within the BCF plans for next year. Thank you.
Lisa.
If I could come back on that, thank you for doing a good tag team on the mic here. No, thank you, really great point. And so I think from an unpaid carers perspective, the collective, the joint funding around unpaid carers, it's within the BCF portfolio. Our proposal is that it will remain there because we do see it as part of that key, people are key in that preventative agenda. We also have the all-age carer strategy for Suffolk and the Family Carers Partnership Board, which is providing that greater focus on that area of work. And I think the Health and Wellbeing Board had maybe 2 meetings ago a really great update on the progress of that strategy. So a lot of work is taking place in that space. In terms of the focus on mental health and learning disabilities, There is, again, a sort of core allocation around for people with a learning disability and mental health conditions in that sort of overall portfolio. And we did a piece of work 2 years ago, which I don't know if you're cited on, Kath, around allocating some of the monies available for support for hospital discharge, specifically around mental health and supporting the greater join-up between physical and mental health in acute wards. The person we're working with from within NSFT is Jay Joseph, who, as you know, is a joint employee across the ICB and the County Council, so really well placed to do that join-up, and he's actively involved in the development of those plans. But yeah, more than happy if there's a further conversation to pick that up with you as well.
Thank you.
Thank you. Andy, you had a comment.
Yes, if you don't mind, as an observer, thank you, Alyssa, and thanks for involving us in the workshops, and look forward to the next stage. Just a point on the prevention aspect that Stuart was talking about. If we look further upstream to the voluntary community sector, is there any, because there's such a call on the limited funds that are available, but is there any consideration about moving that band towards more of that voluntary community sector so that you can help people earlier and prevent hospital admissions, care home admissions and so on? And I'm thinking about everything from befriending schemes, dog walking schemes, anything that helps people to cope.
I think we're all absolutely recognising the key role that the voluntary and community sector plays in this space, and that's not limited to the work around the Better Care Fund, of course. It's built into the way in which we work in neighbourhoods, and our neighbourhood team model is absolutely about kind of strengthening those connections. I think, again, we're all incredibly keen to look at opportunities to strengthen and increase the resilience of the VCFSE, recognising that role, and some pieces of work that are talking to that at the moment are thinking we're doing within our adult social care transformation around our sort of universal offer, our tier 1 offer, helping us to identify where there are areas of the VCFSE that need support or strengthening, the role they play in that preventative offer, and what we can do to work with them. There's also work that's taking place corporately that is being led as part of our commissioning work streams, which is around looking again at what we can do collectively to support and strengthen the County Council's relationship with the voluntary sector. And of course there is also work taking place within the ICBs. I'm less directly cited on that, but wondered if any other board member would like to sort of respond. Thank you.
Okay, thank you. Any other comments before we round up? Alyssa, would you like to round up, or are you happy now?
I think thank you very much for the discussion, and indeed for the sort of increasing appetite to help us shape what we do around the VCF. It's very welcome. As Stuart has touched on, a key goal for this piece of work through the review has been around making it a more meaningful conversation for health and wellbeing board members. So we're making the most of your valuable insight. So that feels like a very positive journey. And I hope that you feel you've got the assurance around the formal, the legislative bit, the sign-off of our quarterly submissions, and are comfortable to do that. Thank you.
Thank you, Alyssa. And I feel that those comments help us and provide us with the assurance to sign off quarter 2 and quarter 3 of the submissions, and the comments have been noted. Thank you very much, everyone, for your input. Moving on now to agenda item 8 is Commissioning Strategy and Population Health Improvement Plan, PHIP, for the proposed NHS Norfolk and Suffolk Integrated Care Boards. On my papers, I have Ramesh, who is with us today, and Liz Joyce, head of the System Transformation NHS Suffolk and Norfolk Integration Board. I'd like to welcome you and ask if you could present and also introduce yourself. Thank you.
Thank you, Chair. Yes, good morning. I'm Liz Joyce, Head of System Transformation. And Ed, I don't know if you'd like to introduce the item, and then I will follow up with a bit more of a detailed explanation, if that would be helpful.
Yeah, I'll just say a few words. So Norfolk and Suffolk ICB comes into being 1st of April, so it's a matter of days away. We've developed a commissioning strategy and population health improvement plan for the next few years, which is obviously going to shape all of our work, so it's a really important board item. I'd like to thank Stuart and peers in Norfolk Public Health who produced a joint needs assessment for us. That's the foundation for this plan, really understanding need within our communities. And we've developed a set of clinical domains where we will be agreeing a set of priorities, and we have an investment fund which is significant to invest in schemes across Norfolk and Suffolk, and we're looking to at-scale schemes that have the biggest impact. We have some very exciting news in the pipeline around obesity and weight management, which I'll report at the next board when I'm able to do so. So that's the shape of it. As with any plan, it will change and evolve as circumstances change, but this gives you the shape of our priorities, I think, and we're really pleased with the work that's been done, especially given doing this during a period of major organisational change. So those are some introductory remarks, and I'll hand over to Liz to talk through the detail.
Thanks, Ed. So previously, we brought a paper to the Health and Wellbeing Board in November. So that was an introduction to the work stream as it was going through, building on previous joint forward plans and other strategic pieces of work that both ICBs and partners had been working on up until then. So we definitely weren't starting from a clean sheet. And it's very important that we focus on the delivery element, which I'll talk through in a little bit more detail in a moment. But in terms of the overarching strategy, there is really clear alignment with the NHS 10-year plan. So think of it as our local response, I think, to the 10-year plan, and especially very much aligned with the two health and wellbeing strategies, the Norfolk and the Suffolk health and wellbeing strategy. So we've got really clear alignment when we look at the 4 priorities in the Suffolk health and wellbeing strategy. They absolutely flow into the strategy, and we've got some specific work around work and health. Our children and young people are one of our domains that flows through in terms of our life course approach, and very much focusing on our aging well population as well. So the strategic framework and the overarching umbrella is really key in terms of how we've approached this work and how we've pulled it all together. As Ed said, it was underpinned by a really focused piece of work around an integrated needs assessment, and that is reflected through the strategic commissioning framework approach now for ICBs as we shift our focus into very much a strategic outcomes-based approach going forwards. And that integrated needs assessment forms part of our evidence base, and that very much is the thrust of the response. The overarching strategy, which is in the papers, has got 3 outcomes around healthy life expectancy, reducing health inequalities and improving access. And then it's got 4 really clear ambitions, 3 of which are from the NHS 10-year plan, but also the really important 4th one, which was determined locally around the social and economic development and the much wider context that we work within. So the work, as I say, has been going on for some months now, and we've had really supportive partner feedback from a range of really good organisations, and the feedback that we had was very much about focusing on the healthy life expectancy and earlier intervention and making sure that prevention is a really clear priority. Delivery is going to be absolutely key. So the strategy has been well worked through. The ambitions seem to fit really well with national and our local Norfolk and Suffolk priorities and what it means for our local population. We've been really clear about that. But what we must do now is make sure that we deliver. And in the Population Health Improvement Plan, we've really tried to set out our anticipation and expectation of ourselves in terms of transparency, and how we're going to work with wider partners, and it sets out the tone there for leadership and framing that strategic commissioning. Quite a lot of enablers, new enablers in the Population Health Improvement Plan around the clinical and care role of the professionals in terms of setting that out really clearly. I've referenced the importance of the evidence and the intelligence that goes behind this, and then the research and innovation element as well, and evaluation and our workforce teams. So a summary of what we set out to do is in the back of the Population Health Improvement Plan. So that's in a table set through our life course approach. So that's going to be very visible and set out for the public to be able to see, as well as our partners. And there are some very clear measures that we will be measuring ourselves against in terms of population health improvement outcome measures. And again, we want to be absolutely transparent and clear with our populations and come back at intervals and set out how we're working together and what improvements we're making. And then this will be an iterative approach. It replaces, in effect, the joint forward plan, so it's a rolling 5-year programme of work. But this is our starter in terms of setting out forth as a Norfolk and Suffolk ICB in our strategic commissioning role. But the paper's brought here with two quite significantly large appendices, but that is being very transparent about the full strategy and the full population health improvement plan, and we're bringing it here today, Chair, for conversation and then endorsement and an opinion that we would like to publish publicly with the documentation. So that's probably all the comments I would like to make as an introduction. I'm very happy to take questions. Thank you.
Thank you. Open for any comments?
Thank you very much. So Sarah Jane Smedmor, I'm the Executive Director for Children and Young People Services within Suffolk County Council. It's a great read, and I think you've done extremely well to concentrate on children and young people. In the 10-year plan, there wasn't a lot said about children and young people, but it feels like you've been able to really bring that to life in the work that's done here. Really pleased as well with the Best Start in Life Start Well. It leans very well into the Best Start in Life documentation and guidance that we're being given by the government as to how we need to jointly commission into that space. So it just feels like it already chimes with that. There's opportunity, and I'm really pleased to hear you say it's sort of iterative, because there's reforms coming constantly, and in the children's space, thick and fast. And something Lisa Nobes and I, your Director of Nursing, have been talking about is the joint commissioning for children with special educational needs and disabilities. There's a greater focus on that in the Schools White Paper and the SEND reforms, and it feels like we could build on what's in here if needed. So it's really helpful. Thank you.
Thank you. And Nadia?
Thank you, Chair. Yes, what a read. But it's good. There's so much in here. There's so many little organisations and then little committees and then little groups all within. So I'm just going to concentrate on what I feel is the indicator of success, and that's the workforce, and that's the people who are going to be delivering. So I like the idea that the 10-year plan devolves the power down to more local levels. But on page 39, the workforce section, addressing shortages in high-risk areas. So I wondered where we were at with that, and who is going to look after that. There's detail about the what, but I'm not quite sure the who. I'm a bit confused about that. So how are we going to ensure the apprenticeships and the workforce, the gaps are filled so that this can succeed?
So I think I am going to have to take that away and have a look at that, and I can perhaps get back to you. So we can I can reference that. I haven't brought my pages with me. So is that in the strategy or the Population Health Improvement Plan? Was that in the strategy document? Ed looks like he's going to help me out because he's got... Yeah, okay.
Can I ask Ed to come in on that, please?
I've tracked down the details, so I'm kind of worked out an answer. But if I introduce you to Amanda Lyes, who's leading on this area, she can then talk you through it and plug you into the right governance if you wanted to get more involved with it. But it's a whole system response really. It's not one partner. It's a big area, isn't it?
And concentrating on the gaps and how we're dealing with that, and then making sure once we feel that we don't lose others, and so that you've got a robust workforce to deliver this. And then I think the plan is, very, very good.
Thank you.
Thank you for that, Nadia, and I think that highlights the situation there. It's such a massive amount of work, the continuing work, especially looking at Norfolk and Suffolk coming together, all working together, all the health and wellbeing boards coming together, the NHS 10-year plan, which is very fluid and has been known to change as we go along. I'm sure that Ed will have a look at finding you a response to that. Stuart, please. Oh, sorry, Wendy. My apologies. It's my writing, I can't read it.
It's okay. It was just well, thank you, first of all, for the report and to have pulled it all together at such a challenging, interesting time that we live in. And it's brilliant that it builds on so many things that we've achieved over the last few years. I love the fact that it's iterative and that there's evaluation. My question would be, not surprisingly, is there's lots of emphasis on data, which is great, but I wondered about lived experience, thinking about some of the work we've done recently around things like people waiting for elective care, and actually when you speak to them about the things that they can unlock in terms of what they really need and the things that we can maybe stop doing that just get in the way. So I just wondered how you could include that.
So once we get into the commissioning intentions themselves and the detail that underpins that strategy, all of those individual work streams are absolutely then going to be worked through with that approach. So the work that Suffolk Health Watch have done on the waiting list is incredibly insightful, not just relevant to Suffolk either. It's messages that apply across the piece, and we've worked with you on that response, and it is incredibly insightful. So we would expect, for example, in the commissioning intention around elective care, that is exactly where that work will be picked up. And we haven't, in the papers, got sight of the full commissioning intentions because they're so lengthy, hence the table. But under elective care, there is reference to that work, Wendy, as an example, and absolutely through all of those commissioning intentions we would expect. And that's very much the shift. The strategic commissioning framework sets out how we will work through the doing and the delivery, and working with people who have had those experiences and other groups is absolutely the role of commissioners going forward.
Thank you. Stuart, please.
No, thank you. I mean, it's a fantastic thing to be done in such a short period of time, and it does tell a coherent story within there. So I think as part of the feedback process, I do want to say, first of all, thank you to ICB colleagues for involving us so much in this process. So we've had a good opportunity to feed in, and very much from my perspective as a Director of Public Health and Communities, there are very much the right things in there. We've got a really good focus on primary prevention around smoking. Ed already mentioned weight management and alcohol. Also that acknowledgement around health protection, recognising that we are seeing more and more infectious diseases coming back, particularly around things like TB and stuff like that. So actually really welcome that and that focus on work and health. So I think, a thank you on that, and an acknowledgement that very much is fitting with how we can work together on some of those. I think the bit for me is, and I think something that's becoming more and more aware to me, is around this piece, and it talks about prioritisation approach and using health economics approaches in there. We know that technology is moving very quickly in the medicine space and in the digital space. And for me, I think, and it'll be something useful to come back, I think, at some point, is about what that approach, that prioritisation will be. We've got the commissioning intentions, but necessarily what will we be able to afford to do within some of that. And I think it's an acknowledgement that how we balance off the challenges of those new technologies and new drugs versus actually the affordability around some of those, and getting that balance about how we get the best outcomes for the population as a whole versus sometimes incremental developments in some things. So it's probably not a question. I think it's more a thing that it'd be useful, I think, at some point to come back as that evolves and develops, to look at how we do that prioritisation piece, recognising that we know resources are really challenged, and that goal around healthy life expectancy takes quite often, it's some of the more simpler things that will help to drive some of that rather than some of the really specialist stuff. Sorry, I don't think there was a question in there. It was just more of a statement.
It's okay, my mic has decided to play up on me. Jan, please. Councillor Candy.
Thank you, Chair. It is more of a comment as well, but perhaps following on a little bit from what Stuart has said. So East Suffolk Council is now a marketplace, and that's all about tackling inequalities. And I've been learning with this, we really just got going. This 80% of poor health is down to social determinants, and that is something we can all work for. So thank you for the report, which more or less says quite a lot about that. So we've really just got going. We're just about to identify a couple of projects that we're happy to share if you'd like us to.
That would be really helpful, and we've referenced the marketplaces in the strategic work, but interestingly, that fourth one that the area you referenced, the social and economic development and the wider determinants of health, that's the rationale for adding it into the fourth ambition. So absolutely, it's astonishing, isn't it, that it's not surprising really, but that is such a huge implication and huge factors. So yeah, it has to be in there, and that's why we've made that our fourth ambition. Yeah.
Thank you. Ed, would you like to come back on that, please?
Yeah, I think if Chris Bally was here, he would say don't forget about Waveney. But just to state the obvious, now we've got a Norfolk and Suffolk plan, there's no forgetting about Waveney. So we can look at the county of Suffolk, but we can also think about, your council geography. We can think about Great Yarmouth and Waveney. We can think about Lowestoft, etc. So I think hopefully this geographical plan will be better from that concern that's been a perennial issue at this board for many years.
Thank you. I believe Warren was next, please.
Thank you. Thanks, Chair. First of all, I just want to say thank you to ICB colleagues for sharing this so widely. I think I've heard about it virtually in every meeting I've been to so far, so it's really good that it's been shared so transparently. My query goes around really about strategic commissioning and perhaps some of the approaches that might be adopted around that, and whether at some point, and I appreciate how busy it is at the moment, whether people working in that system, on the fringes of that system, may need some education around that, particularly around outcome-based contracting and commissioning, and some support, because that's a slightly different world to what they might used to be.
Absolutely, and we recognise we're not. It's a culture shift, it's a change, and the strategic commissioning framework absolutely sets that out. So the ICB, I think it's fair to say, Ed, is under, this is a new framework, isn't it? And we're moving forward. So we're definitely not setting forth on this with a level of complacency or expectation that we know all that there is to know about this. Absolutely, there's leadership and development to go alongside this to absolutely, learn and do different. Yes.
Ed, your comment on that, please.
Yeah, I'm just reminded of something Wendy said to me many years ago, is that when you're working with the voluntary sector, pose the outcome you want to deliver and allow them to come up with a solution. Whereas I think traditionally commissioning is, here's the outcome and here's all the mechanical things we want you to do to deliver that outcome. So I think what we're trying to move towards, Warren, is putting the outcome into the system and then the partners agreeing creatively, collaboratively how that outcome can be achieved, rather than overly prescribing the way to do it, which is, it limits your creativity and innovation if you do it that way. So hopefully that will appeal to you and your style of leadership and others as well.
Thank you. I believe, Joanna, did you wish to speak?
Yes, please. Just having gone through this quite quickly, it looks really comprehensive and really very good. I had one little comment around dementia support and one of the longer term priorities. Just from somebody that speaks to them daily, the dementia intensive support team are marvellous, and I'd be just a little bit concerned about diluting them with them. I think the plan was to integrate them into the urgent community response. And I think from providers, we use them lots, and you know, if we've got a problem, we're on the phone to dementia intensive support teams. So I'd just be worried about diluting their effectiveness by pulling them into another team. That's all.
I'll definitely we'll make a note of that, and yeah, integration needs to be integration, not dilution, doesn't it? So and that's under the ageing well domain. Yeah. Okay. Thank you.
Thank you. Yes.
Thank you for the report. It's great to see, so I'm from the University of Suffolk, so I am going to follow on from Wendy's comment around evaluation. It's great to see that evaluation is mentioned in there, but I think it's really important, and I say this at most meetings, that you have that really clear framework. So if you want to have a conversation around what that might look like and have an overview of that, then I think that, rather than doing kind of some of the piecemeal bits, I think having a bigger framework would be really useful to kind of look at. But it's great to see that it's being thought about, but we can maybe help you expand that.
Thank you. We have we've got a really good developing evidence and evaluation team in the ICB, and we do work with both universities in both counties as well. So absolutely, yeah, we're really keen to, you know, not retrofit solutions. It's got to be evidence-based, and you do proper evaluation, which is time-consuming and well worth it. So yeah, absolutely. So we'll be making sure that that is integrated into our commissioning cycle, and that's again part of the vision, the approach, and the way in which we're going to approach things going forward. So yeah, thank you.
Thank you, Chair. Sorry, my voice is a bit croaky. In the commissioning intentions, where do you see female reproductive health in this? Because I'd like to see where it's in. I mean, I see that it's in the perinatal bit, the midwifery, but I don't see it mentioned anywhere else in the commissioning intentions. How do you see that being integrated into each stage? Because I think that's a rather important point.
We've certainly got some, there's reference to women's health hubs. I can recollect that, which I recognise is perhaps not what you're describing. That might be something slightly different. But certainly we've taken very much a whole life course approach. So we've tried not to put things in boxes. So again, I'm happy to take away that very specific part and have a look to see where that features. I can remember some of the commissioning intentions, but I'll have a look at that one, and we'll feedback if that's helpful. Thank you.
Well, that just runabout sums up what I said about there are more questions than answers, and hopefully we've found the answers to many of the questions today. It's such an enormous amount of work that's being done across our county borders, and as I said all along, I think us working together will find a fantastic solution to the conundrum that was set. Thanks to Ed, and thanks to all the people who have been involved with all this, and all the office of time to try and make it as clear as possible. If there are any other questions that you've not thought of within this session, could you please email us so as we can put them and find any solutions possible. Thank you. So the recommendation to the board was to endorse the final Norfolk and Suffolk strategy and proposed PHIP, and provide a statement of opinion. I believe that Stuart will help me with this one.
So what we will do from that conversation is we will put some points together which we will then share with you as board members virtually, and just ensure that you're happy with that, and then we'll then be able to share that with the ICB, and they'll be able to use that as part of the report, as well as Norfolk's Health and Wellbeing Board as well.
Thank you. And with that, we will move on to the next agenda item. Thank you for the presentation and for all the help on that one. We move on to agenda item 9, which is Suffolk Combating Drugs Partnership, the CDP update. I have various people on my agenda paper who are here this afternoon. It's this morning even. And I would ask you to introduce yourself and to give the presentation. Thank you. We'll just sort out the IT and then we will
I'll
begin.
lean across if everyone can still hear me. Thank you. We have got a few slides. Are they going to appear? Just while we're doing that, by way of introduction, good morning. I'm Claire Harvey, Senior Manager in Public Health and Communities. I'm joined by 2 other Claires. So Claire Beecham, who also works with me, Claire Jakeman from Turning Point, our commission provider, and also Jack, who supports to coordinate the Combating Drugs Partnership. So thank you for the opportunity to speak. I'll just wait for the...
Thank you. If you could move that just a little bit closer to
Yes,
you, that would help.
absolutely.
Okay.
Okay.
Thank you.
Thank you. Just a quick recap by way of background. So every local authority area has to have a Combating Drugs Partnership, and it's on the back of the National 10-year drug strategy. In return for delivering outcomes towards that national strategy, Suffolk has received just over £1.5 million in this current year towards delivering those national targets, and some of those are referenced in the paper alongside lots of other successes that I'd like to bring your attention to in terms of how we've spent that funding over the last 2 years. I think it's important to mention that the funding is primarily spent on treatment, and that's a requirement of the grant. In terms of the board here today, so you are the accountable body for the Combating Drugs Partnership in Suffolk. Our work fits really well with your refreshed ambition, so chimes very well with mental health, employment, and also substance misuse in the older population. Unfortunately, drugs continue to have adverse effects across all of Suffolk, of all ages. It touches individuals, families and communities, as I know you'll be really aware of. But today, the report is brought here to update you on progress, to provide some reassurance on our journey towards performance targets, but also to escalate some particular issues that we think you might be able to help us with alongside your continued commitment for the partnership going forward and across the various work streams. Again, some changes coming down from national government for 26-27. Some of that is around the way that we receive funding. So going forward, we will have a consolidation of grants into a single pot and a commitment by government to fund for a 3-year period, which is actually really positive for us because it gives us much more flexibility in how and what we commission in this regard, and also a welcome reduction in reporting burdens. Going forward, government has given us a bit of a push on certain areas that we absolutely recognise here in Suffolk, and I'll talk a bit more about those in a moment. One is around getting young people into treatment. Secondly, around how we tackle the rising use of cocaine and ketamine, and also the declining engagement with traditional heroin users. And that's a national picture, as I said, that we absolutely recognise here in Suffolk. So the landscape is changing quite significantly, has been for probably the past 10 years, particularly around people's drug of choice, moving away from opiates such as heroin and much more to other substances such as cocaine, crack and ketamine. And in the past couple of years, I think it's fair to say that we have really started to see that shift play out in our treatment services with a really clear decline in opiate presentations to our treatment services, and a steady but sustained rise in those seeking support for non-opiates. In recent months, and certainly over the last 12 months, the partnership has really given a push and a focus on a significant rise in ketamine use. In Suffolk, we currently have 183 adults in treatment who are using ketamine, and that's a 251% increase since 2022, so a real jump. And because of this changing profile, much of the partnership funding that I spoke about has been used to strengthen clinical capacity, harm reduction, and new tailored pathways, very much in that treatment space. So apologies, we're not able to share exact metrics, so we've used a bit of a quadrant here and some colour coding, but it shows how Suffolk is performing against the National Local Outcomes Framework, the LOF. I'm pleased to say the latest data does show many of the measures are improving, certainly in the right direction, and are at or above the national average, and those ones are shown in green. Of note, I think in general the numbers of adults in treatment continues to grow, and we think that's positive in the sense that people are seeking help from our specialist services and therefore have the absolute best opportunity to seek the support they need to get that sustained recovery. There are a couple of lines on the slide in black that I just wanted to flag for transparency and provide reassurance from the partnership perspective that these measures are being interpreted as positive. One reflects social services early identification of children who have drug use as a factor, so it doesn't necessarily correlate with we've got more prevalence. And also the proactive work undertaken by Suffolk Police relating to drug seizures. Obviously, the more they seize, the less is on the streets to do further harm. In regard to the two measures in red, again for transparency, early investigations indicate that this is a data quality issue, and we are working closely with Turning Point, the provider, to improve this with refreshed training for newly recruited staff in all our services. Just to pick up a couple of other positive improvements since we last came to the board, which was in 2024, a rise in the levels of continuous treatment from those in prison through to the community, which is really positive and really critical for their continued success. A fall in numbers of people living with Hep C, and again, Suffolk Constabulary's continued efforts to break drug supply chains and disrupt county lines, for example, and other organised crime gangs. So in terms of young people, last time we came to the board, which was about 18 months ago, we flagged this very same issue of declining numbers of young people in treatment, and it's not unique to Suffolk, it's something the whole country is grappling with. I'm pleased to say after we came to the board, we did see a notable increase, and at that point we did a real focused effort on promoting the services available, training staff and encouraging organisations to make referrals, particularly with thanks to colleagues from Youth Justice and Social Care. I think we recognise that case finding, as we call it, isn't an always easy thing to do, with many organisations, probably many of you in the room, who offer that low-level preventative support through their own organisations and perhaps don't always see the need to make that referral, especially if the drug use doesn't seem problematic. And likewise, some things aren't necessarily in our control. We've got external factors such as the decline in first-time entrants into youth justice, meaning that fewer people are coming through the door, and obviously that means we've got less opportunities to make those referrals. You'll see in the graph in the slide that we have made a lot of improvements since that real dip over COVID, but our trajectory in Suffolk is much flatter than other areas, and we know that there will be young people using drugs in Suffolk, and would once again please ask members of the board to promote and share amongst your networks the importance of making those referrals at the earliest opportunities, obviously to prevent that longer term problematic addiction further down the line. Synthetic opioids, there's been a lot in the press, and I think we started to talk about it when we came 18 months ago. They have recently emerged as a significant threat to the UK and much of Europe, often appearing as contaminants with other drugs, so heroin might be mixed with something else. They can be 500 times more potent than heroin, and obviously there is therefore a high risk of overdose. Just to give you some figures, nationally between June 23 and September last year, there were 524 deaths confirmed to involve synthetic opioids, and in Suffolk we had 6 during the same period. So it is absolutely here in Suffolk, but thankfully not to the scale that other areas have experienced. We get quite a lot of diktats from government in terms of what we can and can't do. One is that all areas must have a synthetic opioids preparedness plan in place. And in Suffolk, we have developed a protocol to ensure that we are able to respond quickly if drugs are identified in Suffolk that could potentially cause harm or have a mass overdose effect. And as we know, that has happened elsewhere in the country. So basically it works on a premise of an alert system which informs a partnership response. It goes into full swing and ensures that both professionals and drug users can be made aware that something is circulating locally, so that they're fully aware of perhaps what they might be buying or taking. It also allows us the opportunity to give that harm reduction advice and also issue naloxone, which I'll come on to in a moment, but that's an antidote that can work within the space of 5 minutes, and really useful drug to have at hand if you are overdosing. It also includes fast-track drug testing from the police if there is a suspected synthetic opioid at play, and again that's where the police swing into action with proactive policing to deter and break drug supply chains at the earliest opportunity. And then just coming on to naloxone itself, as I said, it's a life-saving medication. It can temporarily reverse the effects of an opioid overdose, particularly related to heroin synthetic opioids, but it does also work on other drugs. In Suffolk, some of the funding that we've used from the Combating Drugs Partnership is to increase the number of take-home naloxone kits, which are offered to all clients in treatment, alongside a click and deliver programme which any resident in Suffolk is entitled to access. The evidence is really strong. Early administration of naloxone is key to preventing overdose and fatalities. And again, another ask of the partnership today, please, is that we would ask members of this board to actively consider the use of naloxone in your respective organisations, as it really does save lives. And I think it was only yesterday that Claire told me an example of a very recent example of a housing provider in Suffolk who have recently been trained in using naloxone and have stocks themselves, which was administered and thankfully saved that person's life. So it does have real impact. Just to recap, please, if I may, the ask of the board. So one is to help us to get those case finding so that we can get the numbers of young people into treatment up. Secondly, the use of naloxone in your respective organisations. And lastly, the continued support for the work of the partnership across the board level and also work streams, please. Thank you. My colleagues are much closer to the detail and will help me with questions if there are any, Chair, if that's okay.
Okay, thank you. And thank you very much for the very comprehensive report within the agenda papers. Much of it I've found quite challenging to read. There are known difficulties and unknown difficulties ahead as the situation changes and new hurdles are found. Happy to open it up to the board, and I have Nadia first. Nadia.
Thank you, Chair. Yeah, I agree. It's hard reading. The reason I became a councillor 20 years ago was drug addiction and alcohol addiction. It really worried me for children, grandchildren. I'm really passionate about this, so please excuse me if I drill down into some parts. Now, I've always had a problem with the drug projects that I feel do not tackle reducing demand enough. If there's no demand, there are no drug dealers, there are no gangs, there's no treatment. Cigarette smoking, when I was young and smoking, was about 60%, and now I think it's something like 11%. This can be done, and I feel that's the bit that's missing. And it's understandable, because while we're busy doing all this other good stuff and trying to get people off and trying to get their lives back on track, there's another cohort coming through. And I just feel, and these are just some ideas, okay, and you can tell me if you're already doing it, but this is what I think needs to be done. So the percentage, the numbers of young people in treatment, yes, it may be that more people are being referred, but it could also be that we're just not succeeding where we want to. So to reduce demand, resilience to everyday life, because mental health has changed over the last 20 years, and I do wonder whether we do enough to forge resilience against taking drugs, saying no, feeling strong, feeling confident in schools, starting in schools. A feeling of belonging, which I know we do lots of work on, so I know that one is dealt with. If they feel they belong somewhere, they're not going to feel they need to belong to a gang, but I know we do a lot of good work there. Employment, obviously, apprenticeships, education on the harm. I don't think my grandchildren, one of them's 14, he has no idea about the harm of drugs. He doesn't come across it. I have spoken to him about it, but I want him to know, and I want him to be scared, and I want him to see videos, and I want him to know about death. And I think most people would agree with that. Just, not scare them witless, but give them good education on the harms, and I don't think there's enough in schools. Law enforcement always seems weak to me. We have to prove to the nth degree that there's been a cannabis farm in a house, or, and I know of cases where it seemed to me that there was good grounds for taking them to court and it didn't happen. So there's a lot of people getting away, literally, with murder. Deglamorising, I think drugs are still glamorised a little bit. A public campaign, and relapse avoidance. I gave up smoking 8 times before I actually succeeded, so I totally get the addiction. But you've just got to keep plugging at it, and I think that can be improved. So sorry I've gone on there, but I am just so passionate about this, and it makes me so sad that there are still young people dying, their families are in turmoil, they are really upset, they don't know where to turn, it goes on and on and on, it affects all their friends, and it's not just those that are having treatment. So anything you can say to make me feel better about reducing demand will be very welcome. Thank you.
Thank you. I'll ask for a response in a second, but if I may, I think Nadia has just highlighted the importance of members of this board, especially community members and community leaders. They see what's happening in their local community, and it's having the opportunity to be able to highlight many of the things. I think our biggest difficulty going forward would be becoming complacent of the issues that we know are out there. Everyone, I feel, is doing their level best, but this is an opportunity for all the members of the board to have their input, from their own area of scope and responsibility, and to try and help improve this. I'll pass it over to you now. Thank you.
Thank you, Councillor Cenci. I think, if I may just come in, running parallel to the Combating Drugs Partnership, we have the Suffolk Public Sector Leaders Criminal Exploitation Work Programme, which was funded 2 years ago now to the value of £1.4 million. We work closely with that work programme, and that is very much about breaking those drug supply chains. So whilst it's not key to this particular Combating Drugs Partnership, we do work really closely. And also today's update is very specific on what is quite a relatively small amount of money, £1.5 million, in public health and communities, we do commission much wider activity that looks at training and schools and prevention work, and I'm sure colleagues can come in and tell you a little bit more about that, but it's just because the focus of today was purely about the £1.5 million and the Combating Drugs Partnership. So hopefully...
Can I just come back on that though, because it does mention about reducing demand in the report.
Yes.
But I saw nothing in the report to suggest that, so I welcome the fact that it might be elsewhere.
Sure.
Thank you, and thank you for sharing your passion, and I'm going to try and make sure that I answer all of your points. Young people are really, really important and part of the services that are commissioned across Suffolk. We have a young people service that do go into schools, universities, youth clubs to try and start that early education, that early harm reduction advice about drug use, alcohol use, the harms that are associated with that, so that we're trying to make sure that we're looking at that prevention. Alongside that, I think you mentioned about employment. Employment is really, really important, and one of the services that Suffolk County Council commission is a IPS service, which specifically works with those that are in the treatment service, so have a drug or alcohol issue, to help them with meaningful employment. And by that meaningful employment, it's looking at what that person's, that individual's interpersonal skills are, some of their previous work experience, and how we can support those people to go into a job that they want to. We're not fitting them into jobs that are available. It's about what their skills are, how they can enhance those skills. Mental health is really, really important, and part of my role is I chair the co-occurring work stream. So working very closely with NSFT and other colleagues about how we look at dual diagnosis co-occurring, so how those two addictions and mental health work together. And resilience is really important. How do we teach resilience? How do we ensure that young people and people all throughout our treatment systems learn resilience? And some of the work that's done within the hubs across Suffolk look at confidence building, resilient skills. So we try and make sure that we look at every part of somebody's journey with the, and there's always work to be done. There's always, we're looking at social media platforms for younger people. How do we get that message out on a platform that they use? Because it's all good and well as an ageing adult saying this would be the best course, but actually speaking to our young people, where is the best place that we can put those that advice out? So I hope I've answered the majority of what you raised.
Sorry, yeah, I think you have, and it's good that it's going. Perhaps it just needs more resource for more young people, but until I see that demand reduced completely, it means more money, more staff, more something. It sounds like you're doing all the right things, but perhaps it's just more of, I don't know. But anything that you can feed back to me, I mean, Claire is someone I speak to regularly, I'm really interested in. It's not part of my portfolio as communities, but, it's communities. So, it's very important. Thank you.
Thank you. Thank you, Nadia. And Sarah Jane.
Thank you, Chair. Thank you, Claire, for your report. It's a really helpful report, and I think I'm possibly going to stray into giving some information to Councillor Cenci, if it's okay to do that too. But just firstly, just looking at the report and thinking about, and maybe this is what leans into the question that's just been asked. So definitely in Suffolk, something we're looking at is our youth strategy. And we do some amazing work, but there's more that we can do. So under the Family First reforms for children's social care and for early help, we're really thinking about how we increase that footprint, much more targeted youth support, linking currently. And this will change, and this is the great thing about moving to a unitary, whatever that looks like, is that our youth services will be much more connected. So the County Council's youth services, the districts and boroughs, towns and parishes, so that we can really make sure we are at place in all of those places and joining up. So there's an opportunity to do much more. The Safeguarding Partnership take a really focused look at targeting. So what you're talking about is much more universal, that there needs to be support to all of our children in all of our schools. And I'm reassured that that's a service that's provided if that can offer that it's always challenging because we offer at stage, so you might get into school in year, 10. It's much earlier than that, but let's say year 10. And of course, all children in year 10 will not be the same, and will hear things in a different way and will need information in a different way. So that's definitely something we just need to reflect on. But definitely the Safeguarding Partnership take a very targeted focus, particularly around county lines. And Claire and Claire's team are very much involved in that too. So if that offers any further information, not reassurance, but further information, and we'll be happy to have that conversation. I think, Claire, just one of the things that I looked at was the drop-in entrance into the Youth Justice Service, which we could take as a positive. It's something we're keeping a really focused eye on, because I'm never sure if that's positive or negative. We just need to make sure we're supporting the right children. It's just one point of entry that we know where we can talk to young people around drugs. So the youth offer that we're enhancing all of the time, I think will help to pick up on that. And then just lastly, for our parents, so for care proceedings, which I'm responsible for, so when we apply to the court to say we need the court to help us think about where children need to live into the future, because we don't consider it safe at that point for them to stay at home. A majority of our cases are because parents are drug and alcohol using, and we're really successful working in partnership in making sure that for those children, many of them safely stay with their families, which is real credit to the work of the team as well. So there'll always be needs for us to do much more together in that space, but is working really well. So thank you, Chair. Sorry, that was a lot, but there was lots to think about there.
Thank you. Any response to that? That was a lot. Thank you.
Thank you, Chair. I think just to support, we do collaborate with colleagues in CYP, and there is more to do, and we will absolutely continue to do that. I think you could take some of this as a positive or a negative, but with a positive mindset, we'll continue to do more together, I'm sure. Thank you.
Thank you, Claire. And you may be happy to hear that the IT issue with your microphone has now been resolved. Thank you.
Hi, thank you, and thank you for the report. It's just a couple of questions for me. One was whether I noticed that there was that with people, young people and families being maybe not reporting the drug issues. I just wonder if we've done any work to work with them to find out why, and what might incentivise them to do that. There's obviously a blocker there, and they're the only people who know why and why that might be. My other point was really about youth social action, thinking about Stuart's report earlier on, that often there's a real danger we do this to young people, and actually this is something we need to do with them. And they're probably the very best placed people. You know, we often talk about our system as if it's the people who deliver, but it's the people who deliver and our public together that are our system. So I just wonder if there's more opportunity to shape solutions with them going forward.
Thank you. You raise a really valid issue around young people's voices and how we collect and listen to young people's voices. And part of the Foundation's, the Young People's team, is about encouraging young people that have used the treatment to be peer mentors, you know, people with lived experience, lived experts, because they are the best people to inform how we get those messages out. I still think that there will probably always will be stigma around substance misuse, whether it's a young person or an adult. And those difficult conversations that young people have with family members, and part of the offer in Suffolk is around the work that we do with affected others, is about education, is about educating parents, families, carers about how to have those awkward, difficult conversations. Because once those conversations start, it's that whole family journey then, isn't it, about being able to access. And I think that's really important, that we try and get those messages out, and that's by getting the advice, listening to our young people.
Thank you. Rowena.
Thank you, Chair. I'm glad to see that we're having the conversation about synthetic opioids, because obviously they are on the rise. And obviously the black market nature of drugs is that they're contaminated, nobody knows what's in them. And I noticed that you said that you have the testing equipment to test drugs. Would it be advantageous to have public testing stations, and do you have them already? And that's one question. And the rise of drugs like synthetic opioids and ketamine, particularly amongst younger people, is it the cost of them? Are they very cheap, and is that why we're seeing a rise in them? Thank you.
Thank you. If I could just come back on the testing issue. So we have recently funded some testing equipment for police custody sites. So at the moment that testing is unique to the constabulary, and it's based on what they term trigger offences. So it depends what you've been arrested for. Some offences lean themselves more towards substance misuse than others. Off the top of my head, domestic abuse, robbery, that kind of thing would be more likely to find issues with drug abuse. So no, at the moment we don't have any other testing facilities apart from that, and that's hot off the press. I think we've only literally just signed that off. Would colleagues like to come in on ketamine and other drugs?
We do also have some, they're called, well, we call them nitazene strips, which we can and do give out to individuals, but there's also a risk with that, because what we don't want somebody to do is to test a bit of the drug that they're about to use, it come up as being negative or positive for nitazenes, and then they think it's safe to use it. So we do have strips which are available, but it comes with a really big caveat that even if it comes back saying there's no nitazenes in there, you can't take that as gospel, because the test may not always be accurate. So we do have them, but there's still a huge risk.
I think cost is really important, and about accessibility. So because opiate heroin is dropping off, it's not the drug of choice anymore, and due to things that are going on in Afghanistan, it's not coming into the country anymore. So the cost of drugs will always be dependent on what somebody wants to use. Ketamine, I think, is that potentially now people are only just realising what the effects are of ketamine, because it wasn't, there wasn't a lot of information around at the time when people first started using ketamine about the side effects and what can happen with overuse of ketamine. So yeah, it's about accessibility, and it is about cost.
Thank you. Andy, as an observer, would you like to make a comment?
Thank you, Chair. Thank you, team. Actually, on just a quick observation on the last comment. I used to work in the addiction field, and ketamine was starting to be used in the late zeros and early tens, and even then we were discovering what those side effects are, and it's astonishing the figures today from the report. It's more, I suppose my point is more about, again, return on investment. And I think if we could build up, potentially through our local communities and charities, a volunteer service from young people supporting your ambitions, I think you could actually make a real difference when it comes to encouraging young people and families to take up the options that you're offering. If I give an example later on when I talk about the My Health Our Future survey work, one of the very common things that schools and colleges do when we raise issues that young people have told us about is to create peer groups in their schools and in their education settings, and that really makes a big difference, because there's an ownership of the issue, and there's a trust because it's other young people supporting young people about those issues.
Thank you, Andy. On that, please.
It's just a bit of a reflection on what Wendy was saying earlier, and then Andy's followed up with. I mean, as we mentioned, we've got the work around youth social action this year coming up, and we'll be running further youth hacks. Now, what I don't want to do is to tell young people you need to be focusing on substance misuse, because what we said is we want you to identify what's important in your communities, and what you need to do. But then there may be a bit that we can look at around the opportunity around using some of those approaches. But as I say, I'd go in guided going that the one thing young people have said is, please don't come and tell us we want to talk to you about knife crime now. We want to talk about what's important to us in our context. So I think there's an opportunity there that we can definitely look at, but be guided by young people to support some of the wider work around that.
Thank you for that. Laura, I believe you were next. Where are you?
Thanks, Chair. Thanks for the report. It's really interesting and educational. I'm interested in a conversation about naloxone and which partners or organisations are allowed to have access to it, and is there any scope for broadening the number of partners that can help with that?
At the moment, with regards to naloxone, we have it in all 3 of our hubs, and people will take it out to the satellite services where they work from. So they can give it to the service users, they can give it to affected others, so that they've got it in possession. We also have some of our pharmacies, they stock naloxone. We've also done a lot of training with housing providers, so the night shelters, and linked in with probation as well, so they have naloxone at the approved premises. So there's currently a consultation which I think has just finished, where they're looking at broadening out who can have naloxone. Obviously the paramedics and the hospitals have it as well, and if anybody's been released from prison, then they are able to take naloxone once they've been released. So we're very hopeful about the results of the consultation and being able to broaden it out further. Thank you.
Thank you for that. And Nadia, I believe you wish to come back.
I do, sorry. It's following on from what Andy said and Stuart, and the hesitancy on some of the referrals that you mentioned. If there's a hesitancy, that means their why is bigger to be hesitant than it is to solve. So there's something there about a campaign, and it's split, isn't it? It's children and parents. So with the children, get them involved and talking about the why, it's crucial. But with the parents as well, you know, if they feel there's a stigma, is that more important than actually possibly saving their child's life? So I think a campaign around making their why much bigger and making them think, and not just the parents of those that are worried, but people like me, where it may happen. What do I do? How do I do it? How do I have that conversation with that child? So I just think we could do you agree we could do a little bit more there about making that why really compelling?
Yes, definitely. And I think campaigns are always a good opportunity to get that word out. So yeah, definitely we'll take that forward. Okay.
And Jack, I believe you wish to come in.
Yeah, I was just going to take the opportunity to add a little bit more to some of the comments that colleagues have made, I think answered very helpfully. In terms of reducing demand, I thought that was a very interesting point, and particularly resilience to everyday life. There was a report came out from the MASH, I think it was last year, and it said for the first time the reason why young people are using drugs is actually more to cope with their mental health challenges than for more fun, exploratory reasons. And I think that that's something that the Foundations team is looking to work around. I'll talk a little bit as well about some of the work that I've done previously in harm reduction roles and how that links, because I think that answers some of your questions around education. I'm very much of the same opinion as yourself, in that I always thought it was better to just give young people an informed overview of what the consequence of drug use would be, rather than, I think, what schools push at the moment very often is drugs are bad, don't do drugs, and I think that that's a huge oversimplification. It's something that I'd looked to try to do when I was actually in that role, and actually when you approach schools you will very often be met with that barrier of actually this is the message that our school has, drugs are bad, don't do them. We can't have you coming in here and say this is how you use cocaine in a safer manner or anything like that. And I think that can actually be counterproductive, because it misses the opportunity to get them the education as to what the consequences are and how, if they are going to explore with things, how to do it in the safest possible manner. Reid de-glamorising, and Claire mentioned some of the work that's going on social media and so on. There's some Talk to Frank videos that have just come out, which are actually quite good, and I've been in some conversation with colleagues at OHID, the Office for Health Improvement and Disparities, about actually getting them, and this is a regional conversation, potentially getting them put onto TikTok. Like if you were to see your ads, I'm a bugger for it. I will sit there and scroll on it, and I think a lot of younger people than myself, that would be a good platform to put them on. Naloxone, who can carry it? That was a question. Anyone can carry it. I tend to have one in my work bag. It's something that I've used whilst I've worked for the drug services, and I believe that the best thing for society would be that everyone carried it. It's something that we're all able to. It's not the person who's having an overdose who needs to be carrying naloxone. It's the person who finds them, and you don't know where you're going to find someone having an overdose. The sort of question about who can actually provide it for take-home. At the moment, it's the medical services of the armed forces, treatment providers, police forces and services, prison services, probation and youth justice services, registered nurses and midwives, pharmacists and pharmacy technicians, and registered paramedics. The public consultation that finished on the 9th is into also homeless shelters providing that, and that's something I'm massively in favour of, and Suffolk CDP have answered that we're in favour of. Border force, admittedly less of an impact here. NCA staff, and I think the thing that potentially revolutionary with it, public emergency boxes. So like we see for defibrillators at the moment, if you were to stumble across someone in the street who's having an overdose, you could find it that way. My final point, I realise I've answered a lot there. De-glamorising, going back to that. We worked with colleagues in Norfolk who, as a result of Project Adder being in Norfolk, there has been more funding for drugs and alcohol there. So we've been very fortunate to have a good relationship with them. There's a ketamine conference going on in 2 weeks' time in Norfolk on the 26th, and one of the things that they're launching there is some educational videos that have been produced by, I think it's Norwich University, the arts students. But we'll then be trying to, Norfolk have agreed for us to sort of have those for Suffolk purposes as well, to get more people into service and to raise awareness of what the harms of ketamine are. Thank you.
Thank you for that, that extra information. Any other comments or questions from the board, please? No, that being the case, I think for me one of the recommendations of this is to identify and support on how we as a board can get behind this and help highlight the issues and find solutions. The wording that we've used today highlights that we're all aware of the issues that we have, and we all have deep thoughts on that. Please continue to support this. I'm personally quite shocked that in this time of this century that we are still suffering with the conflict between good health and the use of man-made drugs. Thank you. I'll leave it there. If there are any further comments or is anything else that you could help us with, please do contact us. And with that, I'll move on to the final report, which is being presented today, to promote young people's voices around their health and well-being. And the concerns that they will have. I know that I want to welcome Andy But before that, I know that Wendy wanted to say just a few introductory words. Did you not? Yeah? So I'll let Wendy have her say, because she asked me so nicely earlier. And then I'll move on to Andy.
I did. That's how you get things done here, I tell you. So I just wanted to say a couple of things. Firstly, just about the name change. I don't know if anybody's noticed, we're now called Knowing Works. Healthwatch CIC, so Healthwatch Suffolk CIC used to run the Healthwatch contract, and we also do quite a lot of other commissioned work. Nothing has changed apart from the name, so we're now Knowing Works, that will run the Healthwatch contract, continue to do that, depending on what the government decide to do next year, and but also a whole lot of other work, including the My Health Our Future report. I think it's probably no surprise to anybody that we passionately believe that the only way to shape effective health and care services is with the people that need and use them. And so that's what we'll continue to do. For those of you that kind of know it takes a while to get the name in your head, Knowing Works seems like a really great name to me, because it does, and it's we think that guessing is an expensive waste that we can't afford at the moment. And also, we think of it as like a printing works. We do knowing, this is what we do in our works. So just to talk a quick introduction about the My Health Our Future report. I know we've brought it here before. It's one of the longest and largest studies of young people with young people in the country. And recently, somebody was asking about the impact of it. You know, so what does it do? We deliver it with schools, so we do it in partnership, so that gives us really good reach into schools and to reach people across the piece. It does make it really representative, so we get a really good mix of young people with all kinds of issues, as you'll see from the snapshot that Andy gives you, and you'll see quite a lot more detail in the report. We are really impacty in my world, so like, does it make a difference? The way that we deliver it means that it makes a difference to everybody who participates, because they get the chance to shape the things they want to talk about. They get to talk about them in a safe place, and everybody gets access to signposting information that they can share with their friends or their families, they can take away, and also access to the Healthwatch offer, which helps them find health and care services as well. The schools that take place get a lot of impact out of it, and you'll see on the website that we capture that. It helps them to shape the offer, the things they need to be. They all get an individual report as well as the county-wide report. And it means that we can bring this to places like this and say, this is what young people are coming up with now. And we've talked about, and I know you were talking about how people's resilience can drive them to drugs, to other risky behaviours. All of that we can capture early. We can see what people are facing. And it's difficult, isn't it? Because we all think we know what young people want because we've all been a young person. But obviously that was quite a while for some of us. So the world's quite a different place. So hopefully this continues to provide the kind of intelligence that we really need from the people who can really tell us. So that's enough for me. Andy, over to you.
Thank you, Wendy. And I hope you haven't stolen all of Andy's thunder. It's good to see that although there's a change of name, our critical friend is still there. And on that, I will hand it over to Andy, please.
Thank you, Chair. Thank you, Wendy, for setting the scene. I'm afraid you've got a poor second presenting the report here today. I wish it was Lisa, who's our lead researcher currently for the report, but she's on leave this week. So I've got notes from Lisa so that I don't stray from what I'm supposed to be saying, and I'll try and stick to those. But it means I'm reading a lot of this rather than just talking to you and eyeballing you. So, My Health Our Future explores the health and well-being of young people aged 11 to 19, or up to 25 with special educational needs and disabilities, right across Suffolk. Always grateful every year for the local NHS commissioning body, here in this case, currently Suffolk and North East Essex, and also with support from Norfolk and Waveney as well. Since 2015, we've gathered around 75,000 responses, and that doesn't include a couple of occasions when we've also surveyed parents and guardians as well, as we did last year, which is also available. This presentation today is a very, very brief overview. The 99 full-page report is available online now. Our latest report was based on 9,717 responses. This was last year. And each of those participating schools and colleges that Wendy's talking about received their own bespoke private reports, as they always do at the end of the summer term last year. The reason this is a bit late this year was because of the change in the name of the organisation. Most of the responses were from years 7 and 8. Over half were from females. The majority identified as white, English, Welsh, Northern Irish and Scottish. 13% identified as LGBTQ+, and that's quite consistent each year. And about 4 in 10 reported at least one additional support need, including a fifth of the survey returns coming from young people identifying themselves as having special educational needs. So in 2025, the average wellbeing score, and this is a national toolkit that's used for young people in Suffolk, was 22.8. That means essentially that it's the same as it was in 2024. This suggests that wellbeing has stabilised in Suffolk at a slightly higher level than recorded in 2017. There was a huge dip in between. Wellbeing scores provide a good way for us to evidence some of the impact of health inequalities. For instance, and this happens every year, LGBTQ+ students were more likely to report lower wellbeing than peers. In particular, young people that identified as trans or non-binary often report the lowest wellbeing. And news more recently from government was around NHS access to medical interventions is not going to be helpful. The Office of National Statistics Personal Wellbeing Scale was used for the first time last year. Overall, students and Suffolk students reported lower life satisfaction, lower worthwhileness with the things they do, lower happiness, and higher anxiety compared to 16 to 24-year-olds across the UK. Sleep. It's very important for all of us, and I don't get much of it either all the time, unfortunately, but 54% reported rarely or only sometimes getting 8 to 10 hours of sleep. The data showed a relationship between poor sleep and lower wellbeing scores, as you can imagine, and young people reported that poor sleep has impacted their energy levels, mood, concentration, and relationships. And of course, that impacts on teaching young people. We repeated questions from My Health, Our Future Phase 2, 27, 28, 18, around social media use, and asked people how long they spent on social media on a typical school or college day. Over 4,000 students, which is 46%, reported using social media for 4 or more hours daily, while 20%, a fifth, used it less than 2 hours a day. The data showed there was a clear link between social media usage and well-being scores across all genders. And of course, this is very much an international subject that's being considered everywhere, but not necessarily with young people. Around sexual harassment and violence, for the last couple of years, we've asked about experiences of witnessing sexual harassment and violence. 43% witnessed or heard sexual harassment and violence in their school or college. 43%. The most common behaviours were sexual name-calling and sexual comments about another student's appearance. Still, hundreds and in some cases thousands reported other behaviours, such as sharing sexual images, unwanted sexual messages, unwanted sexual touching, and sexual threats. When asked about reporting, many young people felt there was little to no point. And before I go on to the last aspects of what I'm going to present, there are a few other things that we would have included in slides, but I'm just going to cover a couple of aspects. Safety. Sometimes feeling safe at night is an issue, far too often, in fact. But the most common reasons for feeling unsafe were bullying, knife crime, and gang activity. And I don't know if any of you saw the news from Norfolk last night. It's a very real situation. One point around nicotine use, and we've heard a lot about that today in terms of drugs, and there's a worrying aspect here. The most common reasons for using nicotine, and around 11% do, was to relax and to help manage emotions such as stress, anxiety, or anger, and that was mentioned earlier. Furthermore, and this is the worry for me, just over half of students felt that nicotine use had no negative impact on them. In terms of the future, because we asked them also about their future, one aspect here that I'll mention is that many young people express concerns about it, particularly finding employment, developing the right skills for the career that they want, affording accommodation, and meeting academic or work expectations. One of the aspects in the later parts of the full report is around appendices, so student groups. And one of the student groups of note is around people who identify themselves as unpaid carers, family carers, and the impact it has on their lives and their education. So, Wellbeing has stabilised post-pandemic, but significant inequalities remain. The current survey it has been launched, and we've got around 3,000 responses already, including new topics on unhealthy behaviours, resilience, self-reflection, and much more. The survey's also been extended to training providers for the first time and homeschooled young people. And we really would appreciate any help at all in getting that message out, because very, very difficult. We don't know who they are. There are Facebook groups of families that have homeschooled students in their lives, but they wouldn't necessarily know about us. So any help would be appreciated. Thank you, Chair.
Thank you, Andy. A very comprehensive report and very welcomed. Are there any questions or comments on that report at all, please? Sarah Jane.
Thank you, Chair. Thank you, Andy. There is so much in here. I was trying to really think, I need to ask something really pertinent, and I thought in my role as systems leader, first thing I can say to you is we know pretty much where all of the children who are electively home educated are, so if we can help in any way, that's definitely the role of the local authority. What we're able to do in reaching out to families is, it's very clear in legislation, but if we can help, we'll absolutely want to do that. I'm thinking about how we make sure that these messages go into our strategic vision, really, because what's really important is clearly schools are getting messages back about their schools and their individual schools. That's really helpful. It was great what you said about schools getting peers together. We know that works really well. Strategically, if we haven't done this yet, we need to ask you if you would agree to come to the Safeguarding Partnership, particularly the conversation about safety and what children are saying about their safety would be really helpful. So I'm just thinking about how we can just make sure that strategically this helps in our thinking, and that the effort that children have put in to being able to be this honest. Anxiety, it's not the right word, but anxiety really worries me, because you hear the word anxiety and I'm sat there thinking, what are they experiencing? What are they thinking? What are they feeling? Because I might feel anxious today, Gareth might feel anxious today, but it might be two very different things. And it's how we can really support young people and children to talk about that, so we can help to think how we can support them. This is great work. Thank you so much.
Thank you, and that highlights, we seem to have come full circle from the very first agenda point now to the youth and the voice of the youth. And as this is Stuart's main thought for this year, pass it over to Stuart to comment.
That builds it up a bit. I think for me, obviously we're doing some work at the moment, so Jane and I and others around the Strategic Children's Alliance as well. And I think it would be really helpful for that to be fitting in at the moment, identifying kind of what might be some early priorities for that. And I think definitely there's discussions around, particularly around youth, given we need to do a youth strategy, and also around Best Start. So I think for me, there's very much about how we bring system partners together and to be able to feed that into that piece, and particularly around that and around what our different roles are around whether that more universal level response versus the more targeted stuff that we'll need to do. So I think for me, it's really helpful to be able to track things over time. I think, as you rightly identify, it's then about the so what from that, and yeah, the stats, some of the stats in there are really worrying, but I think some of that then is that next step around working with young people about what it means to them, as Sarah Jane said, because actually I think that's a really important part of it. So no, really welcome it, and I think for me it's about how we build in and how that influences what we do going forward as well.
Thank you. Andy.
No, just very quickly, I wonder if Wendy might want to say something about your conversation with Stephen Skeet and volunteering matters.
One of the things was after the youth hack that we spoke about was that the youth hacks are brilliant because they capture that voice, that depth, and the My Health Our Future work gives you the breadth and the data and some of those things. So we're going to be working with Volunteering Matters and all those young people to see if they could take this and look at it and see how they can drill back down into it, so that it'll create that cycle and hopefully answer some of those questions. So.
Thank you. Councillor Jan Candy. Jan.
Thank you, Chair. Great report, thank you. In East Suffolk, we sent a survey to every one of our Year 11 and 12 high school children. We were looking at where they were going online and where they were going, what they were doing, how long they were doing it, and would they do something outside of school that wasn't online, and how could we help them to do it. But following on from, and we're just coming into that what we're going to do phase now, we've got the data, happy to share if you'd like to see it. But one of the things that came up in the word cloud, which was really set my hair going, was the word they most use in the one box that they have for free speech, the word that came up was fearful. And when you looked into it, they were fearful of school, they were fearful of the world outside. Ofsted came up, so the stress that teachers had with Ofsted, and it was really quite shocking. This whole cohort were fearful, and it was a bit scary, and even to the point of, if you want to meet someone outside the virtual world, what would you do first? And most of them said meet them virtually first. So I think what we're trying to do is open up our community cafes for another couple of hours for a drop-in for after school. We're on the way to doing that, but it is a fearful world for these children, and I quite agree with Sarah Jane. It's scary to think we have this generation of fearful, anxious children. So I just thought I'd share that.
Stuart, you'd like to come back on that one?
I think there's some kind of something that's not congruent actually with what we hear. I mean, one of the challenges that the Stephen Skeet, if he was sitting here today, would say is that actually quite a lot of young people can see what the opportunities are and actually want to talk about. I mean, the biggest issue they have is that us as adults often talk down what's happening and the world around us, and there clearly are challenges. So I think as part of this, that's part of the challenge that we take a needs-based approach. So we want to understand what all the issues and challenges are. But I think what's as important in this is also the narrative around what the fantastic things that young people are doing. So I think as part of this, that's the balancing act we need to bring in, that these are the things we're worried about, but actually these are also other things that are going on as well. Because if not, we end up talking ourselves and young people into that cycle. So in all this, it's a real balancing act around that. And I think part of the next year around the hacks and all the rest of it is also telling the positive stories about what young people are doing. Because I think that's really important as well, that there is opportunity things are being done and all the rest of it. So just a reflection, really.
Thank you, Stuart. And my own reflection on that, I think this is something that we've all faced when we were younger. We all felt that we were being told what we were thinking instead of being listened to what we actually needed to say. And I welcome this year of action to try and change that and celebrate the many, many great things that the young people around us are already doing, and to show that we are now willing to start to listen instead of just speak. That's my 2 penn'orth worth. I will move on. Joanna, please.
Thank you, Chair. So as an employer, we're starting to see this already move through from children into adults when they're coming into the workplace. And there's many lost days of work due to anxiety, and very much what you said around not understanding the difference between different types of anxiety. So whether I'm just nervous to do something new, or whether I'm anxious, I'm truly anxious and it's debilitating. And so conversations I've had with colleagues and things is that we feel that we need to do more to educate our young people about the degrees of anxiety and how they can have coping strategies to support them, and especially support them when they go into the world of work. Thank you.
Thank you for highlighting that. Just how important is that? I mean, I remember, or I recall my own very first job. You arrive on the first day of a new job, you have no idea what you're facing. You have everyone telling you what to do and how to do it. It's great now that we are focusing on bringing a balance to that situation. Thank you. Any further questions or comments? No? Andy, would you like to sum up, or are you happy with the...
I suppose, again, I'll repeat the fact that none of this will have happened without our local NHS commissioners supporting it for 10 years now, which is astonishing, really. There aren't many programmes that run in that way, but we do run it at a loss, because it's the same sum that we received 10 years ago, which is great for us because it is our core, and it's almost our template of how we do things and how we're going to do things in the future. So we're willing to do it that way. But it would be great to have a follow-up conversation with Sarah Jane, for example, because what we've never had is actually a system-wide approach to it. We do try and consult and co-produce with other departments like public health, like children and people services. We work with mental health nurses, with teachers, with parents and guardians to co-produce aspects of it every year. But I think taking the pressure off the NHS commissioners by match funding it or sharing the load would be really great for the future.
I can see Sarah Jane is on your page. Sarah.
Yeah, thank you, Chair. I'd literally just opened my laptop to message Stuart to say, do you think this is something we could take on in the strategic alliance that Stuart had mentioned? Because I think there's a way forward with this, most definitely. So really welcome that conversation.
Thank you, and thank you for that insight and presentation. I think the main thing is we need to get the message out. We need to find impetus and focus in this space. Thank you. Right, where are we? We are at agenda item 11, which is just for information. There is an information bulletin on pharmaceutical needs assessment and an update. The Suffolk Joint Strategic Needs Assessment update, and Feel Good Suffolk. And moving on to agenda item 12, the Forward Work Programme. And as ever, if there is anything that you would, as board members, wish to see in the following health and wellbeing board meetings, please do contact us, and please do let us know what you would wish to discuss. Just a final reminder, the board that the next formal meeting is currently set for Thursday the 16th of July. There will be lots and lots of changes between now and the 16th of July. And normally it says on the agenda, my closing comments. Well, my closing comments today are quite heartfelt. Today will be my final Health and Wellbeing Board. I'd like to thank each and every one of you for every piece of input that you've made. We have got such an enormous amount of work ahead of us. Just ask Ed, the job that he's facing. But every single person in this chamber can have their input. I've been really, really proud. It's been one of my life achievements to have worked with people who were able to influence the health and the future of a whole county. So please continue to do what you do. I'd like to thank in my closing message those who have supported me, my co-chairman Ed, Stuart, who's always been at my right hand to make sure that I don't forget half of it and I don't miss whose hand is going up and going down. Suzanne, without you, I wouldn't know where to start, where to finish, and all the little thousands of post-it notes have come over. Thank you so much. If Hannah just happens to be watching, thank you, Hannah, for everything you've done. I'm really, really happy to have received the information of your current position and situation, and I wish you all the very, very best of luck. Thank you one and all. And my final comment is, when you leave the chamber, could you leave it nice, clean and tidy so there's not too much tidying up afterwards. Thank you very, very much, and it's been a very, very enjoyable experience for me. Have a good day. Thank you. Oh, I suppose I should now declare the meeting closed.